question is an important one after a cancer diagnosis. Your first instinct may be to protect your child from learning about the cancer. On the other hand, as parents and caregivers, you want to be the person your children come to for information, support, and guidance. Talking to your children about cancer can feel overwhelming, especially when you may be feeling overwhelmed with the diagnosis yourself. However, it's a very important conversation to have. Research shows that being open and honest with children helps them cope when dealing with the cancer diagnosis of a loved one. How soon should I talk to the kids? After a cancer diagnosis, people experience a whirlwind of thoughts and feelings. You may need some time to understand the cancer and treatment before trying to explain it to others. But if you notice that your child has picked up on the fact that you're sick, worried, sad, or scared, they may need information sooner rather than later. Children are observant. They will notice changes at home and in your routine. They will notice whispered conversations, closed doors, more phone calls or visitors. All these changes without an explanation can lead to an increase in anxiety for your child. Take time to plan what you'll say. Cancer is a scary word for both kids and adults. Many parents I've talked with are worried that talking about cancer could create a lot of fear. Practicing what you're going to say with a person you trust can be helpful. It's okay to not have all the answers. Just having an honest conversation with your child can ease some of their fears and leave the door open for them to ask questions. A simple explanation is usually best. Be clear about the name of the cancer, the part of the body that has cancer, and how it will be treated. Some parents try to soften the impact of their illness by referring to their hurt place or that they're sick. But young children especially are literal. If they themselves get sick or hurt, they may worry that they are getting sick like mom is. How much information should I give my child? This depends on two main things. One, the age of your child. Older children typically want and need more information than younger children. Tailoring your explanations to your child's level of development is key. The second consideration is the questions your child asks. If a child asks many questions, they probably need more information. Age-appropriate guidelines when sharing information. Preschoolers, very young children, are very literal and need information that is brief and simple. Use books, drawings, dolls, or stuffed animals to help children understand your explanations. Grade schoolers, however, can handle more detail. During the grade school years, children become more aware of death and may ask you about this. In the adolescents, older children are more likely to keep their worries and feelings to themselves. Encourage them to share their thoughts and feelings with you or another trusted adult. What if I get emotional when I talk about cancer with my child? Shielding children from your emotions and staying positive may send the unintended message that their being sad or worried isn't okay. It's okay for your kids to see that you have feelings about cancer, particularly if you let them know why you may be feeling that way and how you cope with those feelings. For example, sometimes I feel really sad because I'm too tired or sick to go to the ball game, but then I remind myself that I'll feel better when treatment is over, and listening to music I like helps too. It can be helpful for kids to know that strong feelings such as anger and sadness are normal, and expressing them can make people feel better. In summary, provide your child with information in an open and timely way. Use gentle language. Offer more details when asked. Be willing to answer questions and show yourself as a person your child can trust for correct information. Convey the message that you're doing everything you can to treat your cancer and that you will continue to love and care for them. Encourage and allow your children to express their thoughts and concerns. Use your helpers. You don't have to do this alone. Call upon allies, friends, family members, healthcare providers, school personnel to help. Try to keep your child's basic routines like soccer games and school activities as close to normal as possible. Finally, check your own emotional, physical, mental, and spiritual well-being. The better you can support your own coping, the better your child is likely to cope. I hope this video has been helpful. However, please remember you know your child and your circumstance best. So take what is useful from the information I offer here and ditch the rest.